Distinguished colleagues, good morning. Dear organizers of the meeting, dear hosts of the meeting, vi благодарам за поканата да бидам дел од овој собир на професионалци. And again, I'm very happy for the opportunity to speak on behalf of Dr. Santino Severoni and WHO Regional Office for Europe. And of course, I'm delighted to be a second female speaker today. Coming to a topic that is in headlines these days, that is being discussed in many meetings and summits across the European region, it is migration, but more specifically, it is public health implications of large migration movements towards European countries. To date, over 800,000 refugees and migrants, according to International Organization of Migration, have entered the European region in 2015 alone, in addition to almost 2 million refugees in Turkey. According to the Office of the UN High Commissioner for Refugees, today there are more than 60 million refugees, asylum seekers, and internally displaced persons worldwide. This is as a result of political unrest, conflicts, armed conflicts, instability, environmental changes, and poverty. The number of people globally displaced by conflict every single day has almost quadrupled, from 11,000 in 2010 to now in 2040, 62,500. These figures underscore the fact that this large influx of refugees and migrants into European countries is not an isolated crisis. It is actually an ongoing reality that will going to impact the European countries for some time to come. Around 77 million migrants are living today across the European region, across the WHO European region, which actually consists of 53 member states. This is 8% of our total population. At the beginning, in 2011, it affected mainly Italy, Greece, and Malta, but the migration routes have changed, and over the last few months, we all know and we see that most migrants arriving in Greece continue their journey through Southeast Europe. Adequate standards of care for refugees and migrants into Europe are not only important for population health, but it is fundamental for protecting their human rights as well as those human rights of the host communities. This is in the full spirit of Health 2020, which is a WHO framework for health and well-being, and it is aligned with the WHO resolution on migrants' health, which is actually a milestone in WHO global work in this area. The European public health response to the large arrivals of refugees and migrants must include adequate standards of health care for all, the protection and promotion of the human rights, and the dignity of refugees, migrants, and host communities. Health 2020 asks for this approach. It is in situation as the current one, when we need to apply our commitments and to protect the vulnerable populations. The migration crisis is, in this regard, the opportunity we cannot ignore. At the World Health Assembly in 2008, member states adopted and approved the resolution on migrant health, which is a modern 21st century public health approach on migration and health. It is now our time to implement this resolution fully. This resolution and Health 2020 framework, WHO framework, is the spirit of our work on migration and health. In September 2015, all member states of the United Nations adopted the Agenda 2030 Agenda for Sustainable Development, which makes numerous references to migrations and migrants, pledges that no one will be left behind on the road to sustainable development. In 2011, and as we heard several times in the opening speech, talking about the beauty of networking, talking about international cooperation, member states approached WHO Regional Office for Europe, asking for support in improving and strengthening international cooperation. Also, coordination work on health issues related to the mass migration resulting from the crisis in Northern Africa. As a result, and thanks to the financial support of the Ministry of Health of Italy, we created the project Public Health Aspects of Migration in Europe. As migration escalates and the routes change, more European countries are interested. Today, more than ever, we need a comprehensive, regional, and systematic public health approach. As refugees and migrants move, inter-country coordination must be strengthened across the European regions, but also with the countries of origin and transit. The activities conducted so far contributed to create a public health approach to migrants' health, and in the next regional committee of WHO in September 2016, an action plan and resolution will be presented. At the same time, the response cannot come from the health sector alone. Guaranteeing good standards of health for the migrant population and for the resident population requires actually intersectoral approach and intersectoral action to address in a coordinated manner both contingency situation and response and the need for migrant-sensitive health systems. This process of adapting health systems to become migrant-sensitive health system is complex and it is resourceful, it is resource intensive. And this is why, again, a multisectoral approach is very much needed. With this in mind, the WHO Regional Office for Europe supports countries by conducting a series of joint assessments to identify gaps, to identify opportunities, and make recommendations. We will continue in this spirit, and we will also provide training on managing the public health aspect of migration where applicable. The health problem of refugees, which is not a homogeneous group, are similar to those of the resident populations. The most frequent health problems we see include accidental injuries, hypothermia, burns, and frostbites, cardiovascular events, pregnancy and delivery-related complications, diabetes and hypertension. Female migrants frequently face specific challenges, particularly with regard to maternal, newborn, and child health, sexual and reproductive health, and violence. The exposure of migrants to the risks associated with population movements, such as psychosocial disorders, reproductive health problems, higher neonatal mortality, drug abuse, nutrition disorders, alcoholism, and exposure to violence, increases their vulnerability to non-communicable diseases. The key issue with regards to non-communicable diseases is interruption of care, due to lack of access or inadequate healthcare systems and providers. As the WHO Regional Office for Europe works closely with public health authorities across the region, we must collectively focus our efforts on attaining migrant-sensitive health systems and policies, and we must stay prepared and equipped to deal with diverse health issues of refugees and migrants. Migrant-sensitive health systems should offer also relevant interpretation and cultural mediation services so that refugees and migrants can overcome health system barriers they might face. This means that frontline health workers, both at entry points but in countries where refugees and migrants will ultimately settle, must have the proper tools and training to respond to these needs and to create health systems which is sensitive to migrants' needs and refugees' needs. We should also seek to improve health information system to better track, to better monitor and deliver data about this population. A good response to the challenges of people on the move requires health system preparedness and capacity, including robust epidemiological data and migration intelligence, careful planning, training, and above all, adherence to the principles of equity and solidarity and to human rights and dignity. The refugee and migrant crisis of today demands immediate action from health sector, but other sectors as well. High quality care for refugees and migrant groups cannot be addressed by health system alone. I need to repeat this again. Social determinants of health cut across sectors such as education, such as housing, employment, social security. However, and considering long-term impact, demands that we support health system with policies and programs relevant to migrant health needs in the future. This will not only be the opportunity for those arriving in the region, but also protect the receiving population. An important step towards a common approach to public health response and public health plans is represented by the high-level meeting on refugees and migrants that will be held in Rome on the 23rd and 24th of November, where strategies and policies on refugees and migrants' health will be discussed. In conclusion, and having in mind that migration is a major social, political, and public health challenge, of course, for the WHO European region, there is a need for development of specific and coherent policies addressing the health needs of all migrants, including asylum seekers and refugees. Even though evidence is limited, we still have enough data to show that there are good practices when it comes to intersectoral collaboration and interventions that foster integration and promote communication between and beyond medical agencies. Improving the collection of data and quality of data with focus on measurement and mapping of good practices and encouraging research to underpin the development of minimum standards in health and social care of refugees and migrants are all actions that should be fostered now and in the near future. Again, I thank you very much for inviting us. I wish you a very successful meeting, and I stand ready to your questions you might have. Thank you very much.